Yep.
To perform an ostomy bag and securement device change, first of all, I want to verify the physician's orders to make sure that he has ordered that we do this. The next thing I would do is I would go into the patient's room. I would verify the patient's identification by having them state their name and date of birth and comparing it to their wristband. Once I do that, I would perform hand hygiene and put on some clean gloves. And then I would take a container, like a urinal or something like that, and I would empty out the ostomy bag, make sure everything is out. Then I would take this and I would undo it from the securement device, take it here, and I would fold it up, making sure not to get everything everywhere, and put it into the biohazard bag. After that, I would take the securement device and gently peel it away from the skin, take that and put it into the biohazard bag as well. After that, I would take just some warm water, make sure that the site is clean. I would assess the site, making sure that the stoma doesn't have any blue, if it's deep purple, or if it's any kind of dusky kind of color, or if there's any breakdown in the skin surrounding the stoma, then I would need to notify the physician. But this one looks good, so I would make sure that everything is clean. I would dry it off. After that, I would take the gloves and I would throw them away. Take those off and throw them away. Perform hand hygiene again and put on another pair of clean gloves. After I get these gloves on, then I would take a new securement device. I have the new securement device, and you want to just kind of eyeball where you're going to cut, because you're going to need to you're going to need to trim around the inside to fit it to their ostomy. So what we would do is just eyeball it, making sure to trim about 1/8 of an inch around the stoma, because if you get it too tight around the stoma, then it's going to cut off circulation and cause the tissue to die. If you get it too wide around the stoma, then you're going to cause skin breakdown from the fecal matter that's going to be inside the pouch. You're going to create a new wound. So I've done that. I've cut and trimmed away. I would take the new securement device and I would place it around the stoma, and I would firmly press around, making sure that it is stuck to the patient's skin, making sure that everything looks good. Then I would take the ostomy pouch, I would make sure it's all closed, and then I would place it and secure it to the securement device, making sure that everything is clicked into place. I think this one's the wrong size, so if it doesn't fit, just for the sake of demonstration. But after that, I would take off my gloves, I would perform hand hygiene again, and I would document the assessment of the stoma. I would document the assessment of the site, how the patient tolerated it, and when and where the new pouch and securement device was placed.